Thank you to all three for very engaging opening presentations. As I mentioned at the start of our session, we do have a few minutes for questions and comments. The microphone is at the center of the room, so we hope that many of you will take the opportunity of putting questions or share your reactions with fellow panel members. As I wait for the first brave soul, I was struck by two things. In all of your presentations, in your own ways, you all alluded to two things. The first one was a concern about the fact that continuing care, home support, home care issues were not integral to the health services reform debate. So there seems to be a concern there. The other observation is you all talked about services that we would not naturally think about when we have the healthcare frame of mind, whether it's some yard work or some building standards or other things. And I wondered, what strategy would you employ to bring that home care debate more close? How would you integrate it more closely? But all the while, how do we protect that breadth of that broad view of what we consider to be home support services, and how do we avoid the medicalization of that debate the closer we get to health system reform? I don't know if anybody wants to jump in first. Marcus?
Thank you very much. I think basically we all have different roles to play, and the role that I have is to try to do good, high-quality, credible research that informs people and informs thinking, and Nina and many of the other people in the room do the same thing. That's what we can do. I'm often talked to by people who want me to be more of an advocate, and I say, I don't want to do that. I want, perceptions are what perceptions are, but at least in my own sense, I feel my job is to do the best possible job I can on research, and then other people would do other things. So frankly, I think that's what people like myself do. Then it's really up to people like yourself, CHSRF and other organizations, to take that information and use it constructively and lobby for change. And I know, the Organization for 50 Plus and so on. But it needs to get onto the radar screen. But it's really something that needs to be done either by the public, people here, or by organizations that have, in fact, access to ministers and prime ministers and so on, like yourselves.
Thank you, Don. And or Donna, if you want to jump in, and then we'll go to our first question. All right.
I have to say, again, we need some good research, and we do need advocates. We need, organizations. Sometimes it's, health policy is tough to kind of get going. Somebody, to make an impact, like being an advocate or whatever, that someone likened it to throwing a rock at a train and hoping it'll get in one of the windows as train as it's speeding past. There's sometimes incredible windows of opportunity to be there when governments are talking about, okay, do we put this bit of money, or do we shift money from here to there? Certainly with the federal government, with the Accord, the first Accord, actually, believe it or not, was supposed to actually focus on, let's increasing home care, and it ended up looking at wait lists and wait times. So again, where was the consistent, loud voice advocating? So in addition to the good research, we need to have some clear, loud voices advocating for home care.
Thank you very much. We have our first questioner. I invite you to identify yourself and then state your question.
I'm short.
I know what that's like.
Okay, well, obviously I'm not a baby boomer. I'm an older adult. And my question actually is for Dr. Shine. And first of all, I just want to say, as an older adult, how pleased I am that you actually talk to us.
Wonderful study.
A lot of people don't talk to us. But my question is, it's about your the housing. Now, it seems to me your focus was a lot on people who owned their own houses or who were going to, as baby boomers, own their houses. But there is a significant number of older people now, we have a lot on the Sunshine Coast, who need some form of social housing. And what I'm wondering is, have you talked to any of the organizations or government who provide social housing? Because we have on the coast a long waiting list of older adults who need social housing, and it's not available. But those who build social housing now build it at 2 or 3 stories. So I'm just wondering, what, if anything, you have talked to.
Well, my research actually included all seniors living independently.
Okay.
So I stopped at assisted living. So I included seniors who were in apartment buildings, condominiums, seniors' homes, independent living homes. It would include people in something like an Abbeyfield home. You're absolutely right about social housing and the lack of space and a clear understanding of the need. I've got to be a little bit cautious here, because one of the things that is going to happen, my research, my understanding of the way that the younger old are thinking, is that social housing will become a less acceptable alternative in the future. And that means you have to be very cautious about building places that will be empty 20 years from now. And I think that's the challenge that governments are facing. They want to increase the amount for those seniors who clearly need that social housing, and yet they are very reluctant to invest because current research is telling them, people like myself are telling them, that it's not likely to be very much sought after by the next aging generation. So that it's quite it is a real challenge, and there are many seniors who with mental, physical, and other challenges as well, who are way underserviced in the existing system. So I highlight it as a challenge that needs to be thought about, but I haven't seen any evidence that policymakers are willing to move on it.
Okay. Thanks very much.
By all means.
Sorry, I just had a follow-up on your original question, your first question. In thinking about this, it seems to me that the most important thing that has to happen is that senior decision makers at the political level and at the deputy minister level come to the conclusion that they're ready to recognize continuing care as a major component of the healthcare system. We had that before, we don't have it now. Everything else flows from that. If, in fact, we say, yes, continuing care is a component of the healthcare system, we can ask CIHI to collect data. We can ask the national accounts to make adjustments so that we can see, how much does this actually cost? How big an issue is it? I mean, it's fine for me to say it's the third biggest component, but it would be nice if there were other ways to actually demonstrate that. And if that message actually gets through, then there'll be a lot more policy focus on things. So to me, the fundamental change is that we have to accept continuing care as a component of the healthcare system. And I don't think we're going to get very much further if we don't do that, because we're going to keep looking at things in a separated way.
Excellent point. Thank you. Sir.
Yeah, I think saying that we have people here who sort of can influence public policy, I think it's just about time that we get off our comfortable pew of saying maybe yes, maybe no. What we have to really say is, look, a universal program of home care and home support is the thing to go. It's cost effective, but more so it's good for seniors. Because everything else, these halfway steps don't really solve anything. We see provinces, when we, as seniors organization, put on the pressure for universal programs, they come out with some Mickey Mouse programs which really actually hurt seniors. And so I think it's very, very important that at least people who are promoting public policies should promote a universal program of home care and home support. And it's not really pioneering, because there are a number of countries who have it and have proven beyond a shadow of a doubt that it's good for seniors. It effectively reduces healthcare costs, and it just about eliminates capital costs for a good number of years. So, it's just about time to call a spade a spade.
Thank you. Anyone want to comment on that?
I think you've really raised an incredibly important point. There is evidence out there showing that it works. At one point, about 10 years ago, when I started advocating for home care, they said, it's just going to be another bottomless pit to throw more health care money into. The research now clearly points out that you do save money when you put money into home care and other continuing care. The evidence is there. And again, it's to have a loud enough voice so you drowned out but we need more emergency nurses and emergency rooms and inpatient beds and more bells and whistles that will keep you alive maybe one day longer, but maybe not well. So a wonderful comment. Thank you.
Perhaps I can just add a very quick example. In Manchester, England, when you call an ambulance between 8 o'clock in the evening and 8 o'clock in the morning, when the ambulance arrives at your home and the two EMTs, emergency medical technicians on the ambulance, there's a third person in every ambulance that arrives at Manchester, and it's a registered practical nurse. And the city of Manchester has, by having a registered practical nurse come with the EMTs into the home, has reduced the emergency room delivery calls by 83% between 8 in the evening and 8 in the morning, because the registered practical nurse often can walk into the home and, in particular when it's an aging person, deliver sound, solid, practical advice and guidance that results in no need to make the emergency room trip. And I think it's examples like that we need to beat into the head of our policymakers to understand that there are proven ways.
Thanks very much.
Hi, I just wanted to raise a point that hasn't been raised yet. I think most of us in this room are converts to the notion of continuing care and home care, and that's wonderful. But in order to get those in power who control the resources, in order to adopt this and to seriously consider it, we have to start speaking about vested interests, the powers that be, because we are not talking about building a system where nothing exists. A very powerful medical, pharmaceutical, industrial complex is in existence, and they gain a lot from the current system. And so it also becomes a matter of how do you build another power base. And I don't have the answer to that question, but I've become convinced that it is critical in this whole discussion, because it doesn't seem to matter how much rigorous research we produce, how much good evidence we cite about cost savings, which they say it's all about. But I think it's about more than that. It's also about who are the losers going to be if this happens. And they're the people who right now are making billions of dollars off of the existing system. And they're not going to give it up easily, which I realize is a very pessimistic comment.
Thanks very much. I'll invite the panel to... Oh, of course. And I think Monsieur has a question as well.
My name is Henry Hightower. I'm over 80 and not yet 85, and I'd like to thank Dr. Wilson for telling me what's around the corner.
For all of us.
Dr. Shiner spoke eloquently about the need for better requirements for what goes into the residence. But our homes are not only the residence, it's the environment outside the residence in which we live. As I'm sure you well know, I want to make a pitch for codes or provisions that require public transportation for those of us who can no longer drive for whatever reason. Something that's sorely lacking, and particularly sorely lacking in the rural or far out suburban environments in which most of us live, most of us seniors live. And for comfortable walking areas. Like many seniors, I'm a dog walker. It's absurd that I have to drive to get to somewhere where I can walk my dogs in a park-like environment and meet other seniors who are doing the same thing. We need to plan communities better, and we plan communities better if we build in neighboring, getting to know other people who live in the same place, which happens if you provide ways for people to meet informally.
I couldn't agree more about transportation. It was number 3 on the most critical issues to allowing people to age in place. It's a huge rural problem, and I think many age-friendly community initiatives are trying to cope with the challenges of getting people to critical medical appointments, able to get them to those places where they need to be, particularly in rural Canada. It's probably, I would say, right behind energy improvements to the home and making a home itself safer. I would put transportation right at the top of the list. The other quick thing I'll just say is that the Dutch, who are extremely practical, have a wonderful solution for walking. Most of the new seniors apartments that are being built in Holland have been done by adding them on top of shopping malls. And they add 2 or 3 more floors on top of the shopping center, and they're fully featured seniors apartments. But guess where they go when they want to meet their friends? Down to the mall, where they can walk. And they're right on top of the malls. Isn't that clever? Really interesting. We don't think that way for some reason.
Yeah. London, England started doing that in the 50s.
Yes.
If I could add one note about a particular BC problem. It's called Drive-Able. It's seriously impacting seniors who live in auto-dependent environments. This is presented to the public as a way of reducing the risk that senior drivers cause for others. Taking unsafe...
Can I stop you right there?
Taking unsafe...
The research shows that seniors do not cause accidents.
Exactly.
They do not cause problems. It's the young people who cause the problems and cause the accidents. All the numbers in Canada show that seniors are the safest, most careful, and able drivers. They have the most courtesy, and there's a very, very, I don't mean to, I know that you understand this point. There's a very, very small percentage where a senior has an accident because of age-related issues. But by and large, there are far safest drivers.
And that will have to be one last very short comment to wrap it up.
In BC, the government tells us correctly that per licensed driver, seniors are as bad as the under 35s or under 25s. seniors drive less, far less, than all other ages. If you do the thought experiment, what is the chance of being hit, injured, or killed by a senior driver? It's far, far less than those other drivers.
Thanks very much.
We're all going to have Google cars that will drive themselves, and the problem will go away.
Please join me in thanking our panel.